Premier? Thank you very much, ladies and gentlemen. Please welcome to the media briefing of Gauteng. The Premier will take us through of what has been happening in the province, and from there we are joined by the MEC of Health as well as the MEC of Safety. Premier, over to you.
Good morning, ladies and gentlemen from the media, the people of our province. Today we do an update on behalf of the Provincial Coronavirus Command Council of Gauteng Province. Our updates have always included some modeling, including tracking the behavior of the pandemic. We do so through the advisory committee composed of a group of scientists, and in this regard includes health specialists, data scientists, and other social scientists. There will be a presentation from the Advisory Council to give us a full picture of the tracking of the pandemic. It is on the basis of that the Provincial Command Council convenes regularly to look at their reports, to look at the situation in Gauteng with an eye of science and evidence, and work out what an appropriate response is. Escalate in certain instances or downscale some of our operations. We have always presented that our COVID response in Gauteng is based on 6 pillars. That's what is guiding us, central to which is the comprehensive health response. We always also focus on the economic impact of the virus and what the necessary interventions on the economy are. We look at the social impact, and in the period before this second surge, we had measures to provide food relief. In addition, we have been strengthening the capacity of the state and social mobilization and law enforcement. So the national picture, so there's going to be a presentation from the group of scientists who would cover some of the issues. I will spare you that. They are going to do that. That is Dr. Mary Kawonga and Professor Bruce Melado are going to make some presentation immediately after this to indicate where the national picture is and what the impact of it was is something I will spare you again because it is going to come from them relative to the Gauteng province. As we speak now, we have 50,000 active cases in Gauteng province. Active cases are a very important measure of the pace of the pandemic, and this we do. It was 46,272 cases before yesterday's latest figure, and today is 50,000 cases. We are second to KwaZulu-Natal in terms of the number of active cases. We have just surpassed the Western Cape. This is an indication of where the province is going. So although in my input you would have data, a narrative on modeling, and the epidemiology of COVID-19 in Gauteng. That presentation is going to be done. So after this, I want to say that science is extremely important. The reason we have appointed the advisory committee at a provincial level to help us just focus on the specific trajectory of the pandemic in Gauteng is to ensure, like our national government, we respond in our program and campaign and battle against COVID-19 based on very specific nature of our province. And again, I want to repeat that we are a densely populated province. One in every 4 South Africans live in Gauteng. Dense settlements, human settlements, are a great source of concern, and a lot of infections take place in those dense settlements. Huge intermodal transport nodes where people interact in large numbers as they go to work and go about their business. Understanding the nature of our province has always been something that guides us in how we respond. Most of the population of our province is in the 3 metros, and then we've got the 2 districts in Gauteng. Those 2 districts, both in population and economic activity, are much lower. But in terms of the level of poverty and the intensity of hunger in those 2 districts, it's very acute. The level of infrastructure is much lower. So our Provincial Command Council supports the work of the Metro and District Command Councils. This afternoon at 2 o'clock, we meet every Tuesday as the Provincial Command Council, joined by our District Command Council conveners, the mayors, as well as the MMCs for health. So this afternoon we have a meeting immediately after this briefing. The work of the district councils is also guided by the research and the evidence that is showing where is the pandemic moving, where do we have more hotspots, where do we have a lot of activities that are violating the protocols, where do we have people not complying in larger numbers. So the work of the Command Council at a provincial and district level helps to reinforce that, to focus that. We also have the ministers and deputy ministers deployed by national government, by the president. They work with us in the provincial command councils, and some of them are assigned to various districts. You must know that Gauteng is largely a hotspot area. The 3 metros are hotspot areas as declared on the 28th. But as we speak now, we are principally a hotspot as a province. And those, it's only one area of our province, that is Sedibeng. So that was the case during the first wave. Sedibeng came last. But you first have the metros in increases, and then you followed by the West Rand because of the dynamic of the West Rand economy with a lot of mine workers that move in there. It is that time of the year now. People are moving from the different parts of the country back to the province for work. And those who live here, we are expecting also that we are going to see increases in the West Rand on the basis of people returning to work, especially in those mining areas in the West Rand. District command councils are very important. They get supported, and then the executive council of the province then meets when decisions have to be made. Coming out of these processes, if we have to make decisions, resources, escalate here, step up or in one area or downscale in another area, we do so in that way. So provincial coordination is important, extremely important, and then science and evidence, absolutely important in that regard. This is how we have approached the first wave, and we kept improving on that throughout. So again, now if you just look at the Gauteng specific picture, at the highest the highest daily infections we had at the peak of the first wave was 6,531 infections a day. In other words, cases in one day, somewhere in July, in the middle of July, we had, and that's at the peak of the first wave. The highest cases per day we had was 6,531 cases. We know that in the last 4 days, if you just start a little bit from Friday, the rate of increases have surpassed the highest daily rate of infections we had on the first peak. For example, on Friday, the 8th of January, I recorded 6,959 new cases just on that day. So that is the highest point we have had. We have been saying that in the last 7 days, the infection rate has been increasing at a high rate. It has been doubling, but there are also other indicators I'm going to take you through to show where else have we getting increases. Infection rate, it has come down a little bit to 4,200, and I know even based on in the last 2 days in particular, the numbers have come down both nationally and provincially, come down slightly, but we don't want to be complacent. That's not yet a trend, because we expecting that having had so many people returning to our province, we're expecting that we are still going to experience, given the nature of the new variant and the intensity of the second wave, we're expecting that we're going to shoot to the roof in this. This also, of course, is going to be impacted positively by the level of compliance with level 3, which we welcome. The President announced staying on level 3 yesterday. As a province, we support that fully because we couldn't imagine the restrictions being lifted. We support that. We have not yet seen the impact of level 3 restrictions. The scientists say it takes a little bit of time to start seeing a lot of positive impact on at least the first impact we have seen is about hospital admissions in trauma units. That we saw immediately. The number of people in trauma unit for New Year Eve was the lowest ever since. And in some hospitals like Krisani Baragwana, not the lowest ever since the pandemic, but the lowest. They didn't have any admissions. But we're expecting that the real impact of the level 3 measures will be seen later. What we are feeling now is a combination of, number one, the interactions that people had in December, especially mid-December to Christmas, in the run-up to Christmas. We had lots of places where gatherings were taking place, and I explained this, that in some instances young people were the drivers of this partying, including in some instances just where young people just came together violating regulations on highways, R80, Mawapane R80. Is an example of that. And the message to young people is that COVID-19 is, especially the second variant, is also very deadly. A lot of young people, the hospitals are reporting to us that a lot of young people are also getting admitted in hospitals. And it is important that we say to young people, please take care of yourselves. You are not only taking the virus to your homes, but this virus is also very impactful with regard to you as young people. It is also important to indicate that the new cases on a 7-day average, you can see that the cases are going up, except you know, just the brief on the 10th line, but I want to emphasize, warn that this is not yet a trend, but over this you can see up to the 10th of January, over 7 days, of cases have been increasing, essentially doubling up. But if you see the trend in Gauteng from the first, we have had moderate infection, daily infection from December, that increased the September, and as we got to Christmas, increase was being recorded more, and we have doubled the numbers over the last 7 days. It was 4. Here we share with you what the actual recorded percentage is of the increases from the first week of November right up to the 10th of January. That's the information that the researchers are going to talk to, including in testing. There was a period where the positivity rate in Gauteng was really, really low, and when the pandemic was essentially stable and moderate, we had a positivity rate of 6%. But we have now reached a positivity rate of 30% and above. So especially in terms of, so the number of people who are testing, more of them are getting positive results, which is an indication for us of just the prevalence of the pandemic and why it is important that we must take precautionary measures. Another indication that you have to look at, in addition to daily cases, whether they are increasing or declining, is hospital admissions. We would like to say that we have had a stable level of number of hospital admissions in our public facilities. That has been very stable until we got to December. The number started to increase again. There was a period, essentially at the peak of the first wave, where the number of hospital admissions, particularly in public hospitals, were highest at over 3,106. When we combine both private and public at that time, there was a period at the highest point of the first wave. That means at the peak of it, we had more than 7,000 hospital admissions. And here, we're talking about both in the private and in the public sector. But what we are giving you today is just an indication of, with public sector numbers, our numbers have just at the beginning of January, we were as low as 700 hospital admissions. In the public sector, those numbers have doubled to over 2,400 as we speak. Over the last 7 days, the numbers have, in fact, they've tripled to over 2,700. If you ask the question, what's happening in the private health sector, I'm going to show you a slide that shows that the private health is also not coping. We are coordinating, we are working together. In a number of instances, we have also admitted in the public sector some of the patients from the private sector. But we are reaching that level of significance in hospital admissions. We are not yet at the level where all our hospitals are full, but the last 7 days has given us that the numbers are increasing quite rapidly. In terms of another indicator is the fatality rate. Our overall rate is still at less than 2%. That's 1.8%. That's the overall fatality rate in Gauteng province. But when we just do a comparison week per week, we are seeing that the number of people succumbing to COVID-19 is increasing. quite significantly. In the last week of December, it has increased by 123%. In the week that follows, right up to the early January, it increased by 155%. And as now, it has increased just by 10%. So we are recording quite significant, in a week, losses of quite significant. As you have seen that there was a period early on when the pandemic has stabilized where we had 69 deaths per week. Now we have per week up to 433 people who succumb to COVID-19. But this is per week. If you compare to where we were at the peak of the first wave, there was a period where we had 200 people who succumbed to COVID-19 in one day. We are not yet in terms of fatality yet where we were at the highest point of the but we are deeply concerned about the number of people who are succumbing to COVID-19. I want to repeat, at the peak of the wave, we had a significant increase to a point where in one day in July, we did lose more than 200 people in one day. At the moment, our average fatalities per week is 433. This is a matter of concern. Where the peak of the pandemic, we had 578 people succumbing to COVID in 1 week. We have excess. Dr. Mary Kaonga is going to explain what the excess deaths are, talk about this area inadequately. Professor Bruce Melado explained the modeling of the pandemic. If we did not have level 3 introduced on the 28th of December, where will Gauteng be? If we went to or stayed at level 1 in December, where will Gauteng be? Professor Bruce Melado says the modeling team of scientists that are doing modeling say at 90 active cases. Remember, I started by saying we have 50 active cases. So our model at level in Gauteng, we could be double the number of active cases. This is modeling, of course, and they're saying that the results we will see from the positive impact of level 3, the introduction of level 3, and in the slides that we have in here for use, that with level 3, the infection rate is less than what it's been, but this infection rate is increasing. That's why I said it is at 50 active cases at the moment, but it could have been at 50,000. It could have been at 90,000 if it wasn't for the level 3 intervention. So this interventions related to alert levels, in Gauteng province, we can say this, although the full impact of it is going to be felt in a week or two, but there's evidence in some areas already about it working, which also means they continue with these measures of level 3 as announced by the president. We have the evidence for it, that if we just went back to level 1, the situation would be more difficult than what we are seeing now. At the moment, we are concerned with the increases. Level 3 is going a long way in reducing the pace of the infection rate, particularly driven by the infectiousness of the new variant. So also talk about the hotspots. Let me say something I said yesterday when Nico Hospital, Tshwane, and that is the district. There has been the favor of the second wave. We looked in December. The first impact was about the event of the matriculants when the largest of them came from Tshwane. We explained what we were doing to do tracking those and isolation and ensuring that and their contacts are that impact in why Tshwane is leading in this regard, but also the super spreader events that took place there in that area, quite significant. And when we say that to the people, don't hold super spreader events, please comply. There's evidence that comes later. So the biggest pressure at the moment, the hotspot, seeing a lot of those are in the Tshwane Metro. We are working with the Metro to ensure that we address these issues quite substantially. But this is spreading. It is in both in the township and in the suburban. So the second wave folding numbers are doubling. It's not just confined to certain spaces. Hotspots that are in centers, and then you have hotspots in the townships. There's no part of the province that's being spared. The number of infections may be fewer in certain areas. Professor will speak about this once I conclude. So you'll see those hotspots are back to everywhere. Are we responding to the hotspots? So the value of this report to hotspots, to track where the infections are happening, is to guide our tracing and testing teams on the one hand, so that they are directed. They need to go where they know there's evidence that the pandemic is on a rage there. So we use tracking our health to direct our tracking teams, by also direct mobilization, which is the doing tracking, testing and isolating people or those who need quarantining. The second approach to dealing with hotspots is the ward-based response teams. We have a team provincial level led by MEC, the MEC for Gauteng. That team is to drive a program for every Gauteng. We have the ward being part of a war room. Of course, at the moment, the wards. I think there are wards councillors have with command council team. There are areas. The main intention of this ward response teams and ward war rooms is to go into areas. If we identify a street where people continue to make the regulations, or there's a funeral in the area and there's no ward teams are working with the affected communities and the law enforcement agencies, healthcare workers, to look doing in the hotspots. In some instances, if we have an establishment that's not complying, if there's a retail or a supermarket that's not complying, this also makes sure. So we are combining the law enforcement side, but with community mobilization, but also with getting people really to themselves to the campaign. We want this enforcement by the but also be about enlisting participation, society, the religious leaders in this regard, also the various community leaders, including of political parties in our province. This morning, with the leaders of political parties represented in the legislature, to brief them on where the pandemic is, to share this information with you, but also request their inputs, because we can only succeed if we everybody. This is not time for politicking. This pandemic is harsh. If we spend time quarreling amongst ourselves as political parties, and I want to say the same with the unions, it's time really together. Our MEC for health has been meeting with all. She's completing those meetings. Meeting is today to say to all the unions, we need you on board, as everybody. We need you on board, because the unions represent workers who must deal with all these issues. And this is not time for politics. Those who want to spend time involved in politics, we have no time for them. We want to focus on the pandemic. That's our immediate and most important concern. So essentially, given the fact that Gauteng is now in the midst of the second wave, which has a more infectious variant. So what is it we need to do? Firstly, I want to repeat that we welcome that the country is staying at level 3. And therefore we want to build on the level 3 measures. The first thing is to continue social mobilization for adherence and behavioral change, and I've explained how are we doing that. Work with everybody to contain the transmission rate. And the second thing is to ensure level 3 has also still made prohibitions for super spreading events, but it's one thing that they are not allowed. We know there are areas where people organize these events, including those who continue to sell alcohol underground, hold prohibited activities that spread the virus. But we want to make sure that through enforcement and mobilization, we reduce the impact of super spreader events. We are also scaling up testing and tracking. Just in the last 7 days, you saw us on the roads in Gauteng Province, where the police have been doing roadblocks, and the healthcare workers have been doing testing on our roads. The increase in testing is extremely important, but also our tracking teams have also, some of the people who had gone on holiday who are in our tracking teams have now come back. The intensity of tracking is also increasing as we upscale testing as well as isolation. This is an important way. We have learned this lesson from the first wave, that more testing and tracking is useful, so that we know the prevalence in a particular area. If the pandemic is really raging and almost everyone is impacted there, we then know what is the response of our health services in that area. Is there something more we need to do? Can we ensure that we clear some of the facilities in an area that is hardest hit, and see where we can move some of the admitted healthcare workers to ensure that the health institutions and the health facilities respond based on evidence. They respond. So we basically tracking and chasing the pandemic. Where there are more infections and more people are sick in an area, we want to ensure we have more hospitals in those areas. And the other important thing we are also doing is increasing the number of. We are continuing to increase the number of beds. The staffing that we had during the first wave, we took over more than 400 health professionals. We also got additional nurses from the National Health Department. We want to retain them. We had gotten these health professionals on the basis that the coronavirus pandemic is going to change in 2021, so they were on contract up to the 31st of March. We have now decided as the Gauteng Command Council that the provincial government, that's the Executive Council, must to find the money to retain this health workers, includes doctors and allied professionals, includes the nurses, as we deal with this difficult period. So the one clear question about what we are doing to ensure capacity is there. At the peak, we didn't use all the capacity. The first wave, we didn't use capacity. We're going to need a staffing point of view. We also need oxygen. There's a team led by the acting HOD, which has also been engaging with those who provide oxygen, the MEC, that team engaging to ensure that we expand. We don't want of oxygen supply. That's the lifesaver. And this also include increasing oxygen points at some of our sites like Nazareth. In terms of I want to deal with the number of beds later. I'll indicate exactly about staff retain, the number of doctors, nurses, allied health that we request phase, retain them. Their contracts we're going to end of March. We will retain them because it will help us to phase up to this. We need them for the additional beds that we now have, which we didn't have at the point of the first wave. And I'm going to talk to this beds in a minute. So there's still more I would like to share with you, but I will leave a lot of information to Bruce, Eric. But this one I would like to share with you just to give you an indication. Earlier in the week, the admissions, hospital admissions were earlier on. People admitted in our hospital weekend was 4,400. As I speak today, the number has dropped to 4,108. A little bit of so we have a little bit of reprieve, but it is 1,300 admissions are in the public sector. I said to you earlier on we had 2,400 admissions in the public sector, but the number has dropped slightly. And the private sector has increased to 2,780. So you can see what happens. There's more in terms of the number of admissions in both the public and private sector. Increases and decreases. As I say, when we have more available beds, it helps us. And you will see in the report that 220 people are on ventilation as 220, 384 are on oxygen, and then there are those who are on room air and systems. We watch this number of how many are on ventilation very, very closely and how many are on oxygen, because that's where critical care interventions are required. And when they improve, they get moved to the general wards. And I will share with you how many general wards do we have versus how many critical care wards do we have in our province. So, as I say, we have a little bit of reprieve in terms of the admissions in our hospitals. Just over a period of 4 days or so, our situation has improved. The number of hospital admissions have dropped slightly, but you must understand that as we have more infections, we are going to experience more hospital admissions. That there's a directly proportional relationship between the number of people infected. The increase in cases will lead to the increase in those who need some care. So it is too early at the moment to say that the situation is better, because we are not even at the peak. We are just starting the high road. We're starting to walk the high road in Gauteng province. We are giving you information about hospitalization cumulatively since the start of the pandemic. All those numbers including those that have been discharged, it's important to share with the people of our province. There is a picture that, again, Mary will talk to about daily changes in hospital admissions, but I've just given you the cumulative picture that we have less over the last 4 days. But if you look at a 7 days period, the number is still high. So we have a dashboard in Gauteng which helps to indicate and share information with the public. That dashboard indicates what's happening with regard to bed management, and this is information that is accessible. We want to continue to share with the people of our province on what's happening with hospital admissions in our province. The indication of this changes on a daily basis. Sometimes even in 5 to 6 hours the numbers change. So by evening then these numbers may have changed about how many people are admitted and how many are released, discharged, and have recovered. The one important thing we want to say to you, we have a lot of people or patients under investigation who are occupying of our hospital beds. Now, patients under investigation are people who arrived at our office. Some of them they will have symptoms. They will say, I have this problem or that problem, throat, or some even may be able to say, I have breathing problems. They get those test results. First, if someone has been tested, their attention, the doctors know needs this type, so they must be put on oxygen, or they must support, or on a clinical intervention. So at the moment we have a lot of EUIs, patients under investigation, and part of course the test is taking a little time that we are resolving. We want, as people as test, you don't want waiting for long, because as they are waiting and they test results, it is also a risk. It increases the risk, but they're also occupying some of the beds that need to be occupied by those who have been diagnosed, who need treatment. So working with this, so we are managing the PUIs, patients under investigation. We are managing them. Some of them are also being brought at NASREC. We are also going to be using NASREC for that, but others are the people you have seen are in the fever tents. Those fever tents were very useful during the peak of the pandemic, during the first wave. Those fever tents are just to help us deal with people, the patients under investigation, and that's what they have been able to help do. They are not the place for optimal and adequate treatment, because once people are cleared and they are diagnosed, they then get transferred into appropriate wards by the clinicians based on what their indication is. I have spoken about mortality, so I just want to spend a little bit of time now talking about the bed situation. I think this is extremely to say that before the pandemic in Gauteng, we have always been planning about improving some of our facilities. The pandemic has helped us to do the following right now. We have been able to increase the number of beds in Gauteng from, that is general and critical beds, 1,025, where they were 1,025 before the pandemic, and then we have additional 200 beds. We added 2,119 beds, makes you 1,044 beds. So we have added, as I speak right now, we now 2,409 But this is not the completeness of the number of beds where work has been done on and is being done on. But those ones are done. As we speak now, there are beds that are being used to service members of the public in the care sector to help us respond to COVID-19. And the baseline increase has been significant, quantified there. In addition, as we are speaking now, there are additional beds that at the end of January we will have an additional 375 beds plus 150 beds. So that's 525. So by January, in addition, 1,344, we will have 525 beds. This is the work ongoing response, but also looking at preventive ways in partnership with various sectors in preparation for the second wave. Anyone who says no, we are ready for the second and for the first wave, they are not aptly great about their. Firstly, with regard to beds, yes. Secondly, with regard to staffing, we have more. But can we, with this, and that's where our challenge is, we may staffing, and it is a function of how the behavior and the variant, we may go where the peak of the, so we need to work. So our based on the modeling of the first are being adjusted based on the second wave. Capacity that we have in place, we are continuing. There are areas where some of our additional beds have not come forth. The option of projects in one of our facilities, and in another situation, poor contract performance that has been taken. Police, where there have been disruption of project, this is a problem we experience in school, buildings and infrastructure. We work have helped us disruptions at Joy, where we had there were Jubilee completed beds, disruptions Anglo Gold Ashanti, where there's been delay. Each of this, if these are a result, those projects will be enforcement. Been a delay. Opanong Provincial Executive and a very that the contractors who have up to the actual allegations against them. Want to also appreciate that we are going to have 150 that are being completed now in BMW for Brongor Spruit Hospital. Did them in the 555. Spruit Hospitals up governments is taking before of January it over. It's our partnership with BMW. It is going to facilitate relieve the pressure body in partnership or relieve the load. 50 beds at hospital, the 300 bed hospital beds that are at that are completed. George Mukari will in the north of Gauteng, in the south and Gauteng, including Johannesburg and the parts of, and about the west, with regard to the Anglo Gold, that with that project they are complete. We are that the work infrastructure is doing right, so that providing staffing for the restaurant facility in that what we didn't have before. So the program will contain an additional 305 come on February, so that our bill for the number that I mentioned of 75, 50, 5 for the month of January. That in a those are looking at in a were under after the of the first wave, we were under pressure. Some of the party tracks should be. We do and necessary. We said no, we can't Nasrec because fear of the change. Instead of down scale number of beds scaled from 1,000 critical to 500, and we kept the quarantine 500. As now we are in Nasrec, we are going those 500 Nasrec were scaled with oxygen points 2 days back up. Have another full 1,000 bed at Nasrec, critical care with oxygen. They are also 500 beds that will help us. Those beds are to deal with the beds at Chris and other hospitals. Said to you, patient investigation in the beds occupied have already been done. So use the beds at Nasrec. Patient investigation coordinated by Baragwanath. Clinicians at Chris are called operation. But I also want to add that as the rage is very close, should we additional 1,000 beds in addition already only field hospital. Those indications are that we those our team is in department to ensure that we can have, as the pandemic increases, the infection hospital admissions, we can have 1,000. All that together. Conclusion is that we have better capacity at the moment phase. Can wave that in number of beds as well as number of personnel. So health. Remember, these additional beds go with health. That work in throughout by the department in our program. Increase technology in connect and the equipment that there is enough oxygen, make oxygen point going well. Capacity. Do not know how and how deep pandemic in terms of this. Not know. This is why we how many beds. So we have essentially a number of beds before. We are increasing this week. We'll also put additional ones, as I said, they are stream basically not new projects. If we say to the province, without statistical ins, we even be able with so half of the hackers we they've of beds, but we must continue to implement the health protocol so better over the current capacity. So emphasize that although the capacity before first wave but just the indicator that the is going in all indicators, continue to ensure we implement the health protocol so we don't further overburden the current capacity. And I want to emphasize that although we have doubled the capacity we had before the first wave, but just given what the indications are that the second wave is going to be more in all indicators, we would like to appeal to communities in Gauteng to help our healthcare system by continuing to sanitize hands and wash hands, by continuing to wear masks, and by continuing to social distance, and by staying away. If we can afford to do so, let's not go to funerals in the way we used to do, unless it is a family funeral, at which there should also be very, very careful considerations and measures. Alcohol, with regard to alcohol ban, the president announced that the suspension of the sale of alcohol continues. That will help us, and the evidence is there. So we are not going to have a lot of trauma units and the trauma healthcare workers that are focusing on people who are admitted there as a result of alcohol abuse or conflicts or fights or violence or accidents on our roads. That has helped a great deal. I will share with you information on the accidents, what has happened on our roads with regard to law enforcement. So I want to emphasize, we are continuing as we approach this raging second wave. We are continuing to improve. We have better hospital capacity. We are continuing to improve with regard to the numbers, but we also want to make sure that with regard to PPE, we have sufficient PPE. So there is a slide that indicates the MEC is paying close attention to the PPE story. One thing is we don't want to go back to the phase where PPE corruption last year, still such supply affected some from Acela Meat was resolved. We are back on track. Our law enforcement picture. You have all police working roads on the roadblocks before the first Operation Ukaimula. The first stop, there's been significant decline in crime, and we want our law enforcers in the wave. Firstly, they on our road, percent crashes, 5% decrease crashes, 3% in the number of people on our as a result. This is a assessment. Been a 50% crime, particularly crime, but there are certain areas of increased, and that's year from the festive season up to when levels produced. So, percent in crime, result of the work enforcement visibility, but there are crimes where crimes have increased. The trio crimes, essentially, the house, those the crimes included during the those stubborn, transit high, have stubbornly remained. Types of crimes have a much with concern. Gender-based violence in the period of intense enforcement violence has stubborn remain of concern, not decrease. As this takes place in homes, something that will continue attention to. Alcohol have a number of people. We are repeating this story. A number of people in trauma basically been. We note that more people are now wearing masks. Transport blogs have told us that lots of public transport on our roads, but we out the places they monitoring. There's lots of compliance in public transport on our roads, but we know when people get out of the places where they know there's monitoring, they kind of take off the masks. We appreciate those who continue to put on their masks, but I think it is important that we say to the people of our province, we are not wearing masks for the government. We are wearing these masks, we are washing and sanitizing our hands, not for the government, but we are doing so to protect our loved ones, those we interact with, our work colleagues, those we interact with every day. We are also doing so as our contribution to slowing down the pandemic and containing the spread. And there are those who in return wear the masks are protecting us. So the one thing about COVID-19 is that it requires both us to hold hands. If someone does it and the other one doesn't do it, it puts all of us at risk. So we commend our law enforcement officers, but the story is that a lot more of them have also contracted COVID-19 in the last 2 weeks. The police have reported a lot more officers have contracted COVID-19. This is the same with our healthcare workers. A lot more healthcare workers have contracted COVID-19 in the last 2 weeks, in the run-up to Christmas, in the festive period, and in the last 7 days. And this is also impacting on our response capacity. And this is something that the leadership of the police and the leadership of our healthcare system is managing. I want to say the health workers who did not take a break during December, and there are many of them who are going to take a break now in January. The discussion that has been taking place is to say that given where the pandemic is, this discussion has been taking place at hospital level. And I've said to the MEC, also engage the unions. Let's make sure that we have as many of the healthcare workers as possible. We understand a lot of them are fatigued. They work throughout the festive season. The same with our police, men and women. But this is just Gauteng's turn. We saw the pandemic was raging. It was causing havoc in the coastal provinces in the period during December holidays, and we have to face up to this challenge now, especially in the next 2 weeks. We are going to go through the eye of the storm. By all account, we have better resources than we had before the first wave, but if the evidence points to the fact that this second wave is going to be more demanding, it is going to be putting more pressure. It is something that we have to deal with to understand that it is almost a zero-sum game. I want to conclude by talking about education. The focus of our education department currently is to look at completing the marking of the exams and preparing for the opening of schools. There were problems with the marking of the exams because some of the markers decided that for various reasons, including others who may have contracted the virus or were positive, or others just feeling that it's not safe, the department had to replace those ones. So the marking is happening at the moment, is going on, and the department is preparing for the reopening of schools in the new year. But one of the key issues that we're hoping will be dealt with by national government is that Gauteng is going through the eye of the storm. So in the next 2 weeks, our province is going through a period where the increases in infection will continue to rise. The spike in infections will continue, so we must reduce the potential of places which will serve as inflection points. We must reduce the potential of too many places, including in the next 2 weeks, about how many. We don't want a situation where our schools become a critical area of concern. This matter is being dealt with by the National Coronavirus Command Council and the Minister of Education. We hope to hear from her. But Gauteng, the reopening of schools in Gauteng, which was supposed to happen in the last week of June, is coming at a time when we are on an upward trajectory with regard to the pandemic. So it will definitely have an impact, and the department is planning for all various possibilities so that should we lose some time, we will be able to catch up, and that's something that we will deal with. So at this point, I would like to pause and say that it is important that the people of our province, people have come back in Gauteng. We have larger numbers of people who have traveled all over the province, all over the country. Some of the people who are arriving are themselves just arriving to immediately get and things that just in the mission. Would like us for and just to present the evidence from the team advisory on what this really means. Able to take as usual. Thank you very much. Vuyo.
Sorted both Milado as Dr. It has affirmed that if that is the case, Dr. Kawu, us, you can do proceed. And it will have to be ended. Take us through. Okay. Can we just
let presentation Malado's flight and then here.